Welcome back. This is Dr. Rodney Anderson with my esteemed colleague, Dr. Jim Hopper, here with you again to answer 5 questions around COVID-19. Now, it's been a number of weeks since we have recorded a video. I would start just by acknowledging how tired we all are of dealing with this pandemic. It is exhausting on all fronts and has turned our lives upside down. And so our intention here at Family Care Network has been to continue to try to provide medically accurate information to help you navigate your way through this pandemic. And unfortunately, I think there is a lot of misinformation that is out there. That is not helpful. We obviously try to follow the science to the best of our ability and view our obligation and our role as protecting every one of our patients and the community at large. And I hope that everybody else takes on a similar stance. Again, that's easier said than done after 9 months of this exhausting marathon that this has become. But again, we will continue to record these videos as an attempt to share accurate, helpful information. So Jim, first question for you. What are Family Care Network's recommendations for holiday gatherings?
Thanks for the question, Rodney. First off, we really recommend that indoor gatherings as a holiday celebration from people of multiple households don't take place. I'd recommend that you have a holiday gathering within your household. Bring in the extended family through video, FaceTime, Zoom calls, whatever. That if you absolutely want to have family gather together, do it outside. Find a covered space. The moving air outside decreases your exposure. I would say limit the sharing of food, but really the safety of being outdoors is pretty important. I think that, when it comes to travel, I really strongly discourage any non-essential travel. When I review the cases that show up within FCN, within our patients, I see travel involved in lots of them. A simple car ride to visit family in Idaho or a plane flight to a funeral in Missouri. Those are common occurrences where people are possibly brought together unprepared and end up one person shows up with COVID and the rest are at high risk or even get it. Okay, Rodney, I got a question for you. I think we've seen the news. COVID cases are going up. Why are they going up?
Thanks, Jim. That's a good question. Generally speaking, in the fall and winter months, we see an increase in all types of respiratory illnesses. Influenza is obviously one we are all aware of, but many different types of respiratory illnesses. And these are diseases that are transmitted either through the air or through touch. And so when we move from the summer months, when folks are outside at barbecues and bike rides and hikes and such, indoors to where we're in confined, restricted places with poor airflow, all touching the same door handles and, utensils for meals and this kind of thing, the risk of transmission just goes up quite dramatically as a result. And so that's really the reason why every kind of fall into the winter we see obviously influenza on the rise, all other respiratory illnesses on the rise as well. And COVID, as we know, is another type of respiratory illness. So just as Jim said, as it pertains to gatherings, just being careful to try to restrict that risk of cross-contamination or exposure is key. Okay, Jim, next question. My whole family is in excellent health. Does COVID-19 really pose a risk to us?
Thanks, Rodney. Well, yes, it does. I think you need to consider us being our entire community. And so, you having COVID may not make you particularly ill, but it increases the potential that someone around you might get it and they might get particularly ill. We are seeing some unknowns around COVID, and that is that some people, for uncertain reasons, have severe illness. The death rates per case of COVID are decreasing, but there are still plenty of people who would not otherwise be dying or hospitalized ending up in that state. Additionally, the concept of the COVID long hauler seems to be a real one, that there are some ongoing changes in lung function, heart function, and brain function that accompany some cases of COVID that I, for one, would love to avoid, and I hope all of you would work to avoid. Rodney, a question for you. How soon after exposure to somebody else can I be tested? What should we be looking at for a timeline there?
It's a great question, Jim. So really the first question is, what type of exposure have you had? Now, if you have a known exposure to somebody who subsequently tests positive for COVID, you really just need to quarantine yourself, and probably quarantine for a couple weeks and be tested somewhere along there. If you have an exposure to somebody who has respiratory symptoms and you're just not sure, maybe they didn't get tested for COVID or the results were inconclusive or what, when we think about testing for you post-exposure, the key thing is to recognize that it takes a number of days for a test to potentially turn positive. And that has to do with the fact that the virus needs to multiply to a point to be at a significant volume in your body. So, if I have an exposure today and I go get tested tomorrow or the next day, almost certainly those tests are going to be negative, even though I could be harboring the virus in me. And so oftentimes we recommend a minimum of 5 days after exposure to even consider being tested. But if at 5 days, if that testing is negative, and then on day 6, 7, 8, 9, 10, you do start to manifest respiratory symptoms, you should be checked again. Remember, there isn't hardly a test we do in medicine that is 100% accurate all the time. And so a negative test 5 days in doesn't mean you couldn't manifest symptoms and doesn't mean you shouldn't necessarily be tested again. But I do want to come back around to that first point. If you have exposure, close contact to somebody who is known to have COVID or diagnosed with COVID shortly thereafter, your obligation is to quarantine yourself. Probably for 2 weeks would be ideal, and maybe a week into that to be tested yourself. All right, Jim, final question for today. If I have COVID, how long am I contagious for?
Okay, Rodney. First of all, I'm really glad you don't have COVID. But if you did have COVID, present understanding is that you are likely contagious for up to 10 days after onset of symptoms. That's why the recommendations are to isolate for 10 days after starting symptoms. If someone is asymptomatic, we tell them to isolate for 10 days following the day that their first positive COVID test was taken. There is an addendum to that if someone is significantly ill, meaning ill enough to be hospitalized, then those people should consider themselves contagious for up to 20 days following onset of their symptoms.
So this concludes another episode of 5 COVID Questions. Thanks for joining us and listening to our answers. Again, the intention here is to try to be helpful and responsive and provide accurate scientific information. Again, I just want to leave you with the recommendations around the 3 W's: wash your hands, wear your mask, and watch your distance. If we all do our part, and if we all think about what is needed for the greater good, that we can make a difference in terms of stabilizing this and bringing these case counts down. We will be back again soon with another 5 questions. Thank you.